just spoke about everything starts in the gut. If it ain't the gut, could be your gums. A new study's just come out suggesting that's exactly where rheumatoid arthritis starts. That, in fact, it's the state of our gums in terms of, the bleeding and all this thing where we don't take good enough care, seems to be a place where germs will accumulate and then spread through the body, causing a chronic inflammatory response, which is, of course, also known as rheumatoid arthritis, which is an inflammatory condition. So, but yet, the fact it starts in the gum is so interesting, because I don't think, again, people who don't read what doctors don't tell you would never guess. As, with the previous item, they wouldn't have guessed osteoporosis begins in the gut. And I think it's just this. I think what's interesting about both these stories really is just the holistic nature of disease and wellness. And the trouble is that medicine is ever more narrowcast. You get more and more specialising going on, and a specialist isn't going to see gum problems as the issue here. So I just think it's absolutely fascinating what's going on. So what do you reckon, Lynne?
Well, I think it's really interesting to start tying this together a little bit. What they're finding is that gum problems are also indicative of the kind of bad microbiome that we have in the gut. That they mirror each other. And one of the really interesting experiments done by one of our panelists on What Doctors Don't Tell You, Dr. Sarah Myhill, who is a really courageous general practitioner in the West Country of the UK, who has battled the medical authorities on numerous occasions and won. And what she does, she's a very integrative specialist, so she uses the best of both in medicine. But what she's found with vitamin C is that high doses of vitamin C kill all kinds of infections and baddies and create what she says is essentially a sterile gut. But she also finds it creates a sterile mouth. High doses of vitamin C in the mouth get rid of the bacteria in the gut, so the bad bacteria in the gut. So there is undoubtedly a connection between what's going on in the gut, what's going on in the mouth, and that this is why this is so important to sort out your gut, because you'll probably find that when you do, you also sort out gum disease. Yeah,
something very interesting is going on lately, because I've come across a number of relatively young people with rheumatoid arthritis, and it seems to be a growing number who are getting this, what is supposed to be a relatively rare condition. So it's very interesting that something's going on here, that we're seeing more cases in the last 2 or 3 years, and yet no one, I'm sure, is looking at their gums.
No one's looking at their gums. No one's really thinking about their gut, too. I mean, a lot of cases of rheumatoid arthritis that we've discovered in What Doctors Don't Tell You have to do with some sort of bad guy bacteria or pathogen, oftentimes a parasite that is infecting the person and creating this constant inflammation, and that is causing the joint issues. And of course, that same issue goes on the gums. You really have to ask yourself, why is it that gum inflammation is a giant issue in the over 50s? Everybody goes, their teeth are probably okay now. They've got, thanks to modern dentistry, they've been patched up or they're in good shape thanks to all the things we do. But their gums are oftentimes a problem, even with the best of care or a good diet. So you have to ask why. Why is there so much bacteria here? And why is that not the case with indigenous populations that have, great teeth if they stick to their indigenous diet? So it has to be something related to the gut. And it's so interesting to see that connection.
Yeah. Okay. Thanks, Lynne.